So you've decided that your family is complete. This video covers two categories of birth control: long-acting and permanent birth control. None of these methods provide protection from STIs, so use condoms to prevent the spread of STIs. You may have many questions about which methods of birth control might work best for you. Long-acting birth control is reversible. It does not need to be taken daily or even monthly. Permanent birth control may technically be reversible, but reversal is challenging and is not always successful. If you select these methods, it is important that you are sure that you do not want any more biological children. In Canada, long-acting birth control includes two varieties of intrauterine devices, commonly called IUDs. These devices work for 3 to 10 years, depending on the device. They would need to be replaced at this time, or another method of birth control could be selected. There's a device that works using hormones and a device without. If 1,000 women with typical use used a hormonal IUD for a year, 2 of them would become pregnant. Advantages of this method include that it is easy to use, it reduces menstrual bleeding and cramps, and it may stop bleeding altogether. It may prevent endometrial cancer or cancer of the lining of the uterus. Disadvantages include spotting between periods. Some women experience hormonal side effects such as breast tenderness, mood swings, headaches, and acne, which usually go away within a few months. If those side effects are too bothersome, the IUD can be removed at any time. If 1,000 women used a copper IUD, with typical use, 8 of them would become pregnant in the first year. Advantages to this method are that it is a hormone-free method of birth control. Disadvantages are that it may increase menstrual bleeding and cramps. As with the hormonal IUD, this can be removed at any time. With both IUDs, it is possible, but rare, that the device may go through the uterus or perforate it. If this happens, you must seek immediate medical attention and have the device removed. Occasionally, an IUD is pushed out of the uterus and into the vagina. At this time, you would no longer be protected from pregnancy. With permanent birth control, there is female sterilization and male sterilization. Female sterilization is commonly referred to as getting your tubes tied. There are different ways to cut or block the fallopian tubes. Some are more invasive than others, so talk to your doctor about which kind might be right for you. If 1,000 women used this method, 5 of them would become pregnant within the first year. Advantages to getting your tubes tied are that it is permanent, and once it is done, you do not need to worry about birth control. Disadvantages include if you have the implant form of getting your tubes blocked, you need to use another form of birth control for 3 months. Also, this is a surgical procedure and it takes longer to recover from. You may have an incision and there's a possibility of injury to the bowel or bladder during surgery. You can usually resume all activities within a week. A vasectomy, or the male sterilization, is more effective than the female sterilization. If 1,000 couples use this method, 1.5 of them would become pregnant within the first year. Advantages are that it is safer and cheaper than tubal ligation, or getting your tubes tied. A disadvantage to this method is that you must have your sperm count checked, usually about 2 months after the procedure, to ensure that it has been effective. It also has a 1 to 2 day recovery period. Possible complications are rare, but they include infection, swelling or bruising, a lump in the testicles that usually goes away on its own, inflammation of the tubes that transport sperm, or the tubes that transport sperm can grow back together so the man becomes fertile again and could get a woman pregnant. There are a lot of factors to consider when deciding which type of long-acting or permanent birth control method is best for you and your partner. You can check out the myhealth.alberta.ca website, ask your family doctor or gynecologist, or visit a birth control center near you for more information.